Beneath the rolling hills and pristine barns of dairy country rages a silent epidemic. The Bullvine podcast can now reveal 74% of dairy operations are grappling with opioid addiction, a crisis destroying families faster than any milk price collapse. Today, we're exposing why dairy farmers are 3x more vulnerable to opioid dependency than other professions. We'll analyze the deadly cocktail of chronic pain, mental stress, and rural healthcare gaps fueling this crisis, and reveal actionable solutions every operation can implement today. This isn't just another farm challenge, it's an existential threat demanding our urgent attention.
Welcome to the deep dive. For years it feels like the dairy industry's been, hyper-focused, and you get why, right? On the bottom line.
Absolutely. Milk prices, component levels, chasing those extra few cents.
Even the somatic cell count, always chasing that lower number. But today we're really going to dig into something else, something that's maybe whispered about but not really discussed openly.
Mm-hmm. And it's having a huge impact. We're talking about opioid addiction.
Yeah. While we've been, meticulously tracking all those production metrics, this sort of silent crisis has been taking hold, affecting dairy farm families, our rural communities.
It's definitely a tough conversation, no doubt about it. But honestly, it feels like one we just can't afford to ignore anymore.
And the data, when you look at it, it paints a really alarming picture. Recent findings, they're showing that a staggering 74% of farmers or farm workers say they've been directly affected by the opioid crisis.
74%. Just let that sink in for a second. Nearly 3 out of 4 people. The people who are, the backbone of our dairy operations, touched by this.
It's huge. And it's not some abstract problem out there.
No, not at all. The same research shows that 26%, that's more than a quarter, of farmers and farm workers admit to personal misuse or addiction or using opioids without a prescription.
Wow.
So this isn't just about, someone down the road. It's a significant slice of our own workforce grappling with this directly.
Right.
And it's not just a high number, right? It points to something bigger, like a breakdown in the support systems for these communities. It's more than individual struggles.
Exactly. So for you listening, knowledgeable dairy farmers, industry professionals, the whole point of this deep dive today isn't just to say, this is a problem.
Right. We need to go deeper.
We're going to really try and dissect the specific things that make dairy farmers maybe uniquely vulnerable here, get a real handle on just how widespread this crisis is. And importantly, look at potential solutions. Solutions that actually fit the, let's face it, unique and often relentless reality of dairy farming.
And this isn't about pointing fingers or anything like that. It's about understanding the complex mix of challenges that have sort of created this situation and realizing these aren't just isolated cases.
Yeah.
The research we're looking at makes it pretty clear this is potentially an existential threat to the future of dairy farming itself. We're drawing on studies, reports that really lay bare the scope and the roots of these opioid issues, especially in ag communities and specifically in dairy.
Okay, so let's unpack that first bit. The sheer scale. Those numbers you mentioned, 74% impacted somehow, 26% personally struggling. It's hard to even grasp how deeply this runs.
It really is. It's clearly not some, rare thing happening off in a corner. It's widespread.
And what's really disturbing, I think, is how easy it seems to be to get these drugs in farming communities.
That's a huge piece of it. The data suggests, and this is pretty shocking, that 77% of farmers or farm workers believe they could easily get opioid painkillers without a prescription in their community.
77%. Compare that to, 46% for general rural adults? That gap is massive.
It is massive.
Yeah.
And it tells you something, doesn't it? It's not just about, a lockbox being left open. It points maybe to a culture where sharing powerful meds has become kind of normalized, or at least happens more often, a dangerous blind spot.
Yeah, that difference, it suggests, maybe more medication diversion, passing prescribed drugs along, or maybe just not storing them securely enough, or maybe even just informal swapping.
Exactly, and the report we looked at uses this analogy. It calls it like an unlocked medicine cabinet in a freestall barn. The accessibility is just alarmingly high.
It really makes you stop and think, doesn't it? I mean, honestly, when was the last time you were at a dairy association meeting and this was a main topic, seriously discussed?
Or a farm consultant, the ones who have opinions on everything from calf nutrition to parlor throughput.
Yeah.
When did you hear them really dive into opioid addiction or pain management strategies?
It just doesn't happen often, does it?
No. And the research calls this out, this deafening and deadly silence within the industry. It's strange, isn't it? We put so much effort into biosecurity for the herd.
Right, strict protocols.
But the security around medications on the farm, especially powerful ones like opioids, often it's just not given the same attention.
And this isn't just like one specific region's problem either.
No, definitely not. The report names those 5 mostly rural states in the U.S. with the highest overdose death rates: Ohio, Kentucky, West Virginia, New Hampshire, Pennsylvania.
And up in Canada, it's just heartbreaking there too.
Yeah, the numbers are devastating. Over 50,000 apparent opioid toxicity deaths between January 2016 and September 2024. That averaged out to 21 deaths per day in the first 9 months of 2024 alone.
21 a day. Just wow.
It's a truly sobering picture of how widespread this is. And as the report points out, the reality on dairy farms can often be hidden. There's this strong culture, right, of pushing through pain, of just getting on with it.
Oh, absolutely. The resilience is admirable, but it can also mask these struggles.
Exactly. It hides things from view.
It kind of reminds me, you know how we used to maybe downplay transition cow issues?
Yeah, it's a good comparison.
Like you'd see a bit of a production dip, maybe a few ketosis cases, but it wasn't until the bulk tank really told the tale, right? Until those numbers really dropped that everyone collectively went, okay, we need to get serious about this.
That's it. And this feels similar.
Yeah.
A serious problem just simmering under the surface until it potentially cripples a whole farm, devastates a family.
So that leads us right into the why. Why dairy farmers? Why this unique vulnerability? The report really gets into this, starting with something pretty obvious, but maybe we don't talk about the implications enough. The physical toll.
Oh, absolutely. It's intense. Let's be real. Dairy farming is about as physically demanding as it gets.
Yeah, no desk job here.
You're constantly lifting heavy stuff, feed bags, mineral totes, easily over 50 pounds, sometimes way more.
Constantly.
Then there's the repetitive motions. Milking, right.
Right.
Whether it's herringbone, parallel, rotary, hours of the same movement.
Day in, day out.
And bending, kneeling, reaching, often in really awkward positions. Working with large animals that don't always cooperate, fixing equipment that breaks at the worst times.
Preaching to the choir here.
And these aren't just, occasional aches. This is daily, relentless. It builds up over years. The report flags these crazy high rates of musculoskeletal issues.
Like what specifically?
Well, anywhere from 50 to 65% report lower back pain, almost as many, 47 to 61%, with shoulder pain, and lots of neck, wrist, hand, knee problems too.
That makes sense. All that repetitive work, attaching units.
Exactly. Leads straight to things like carpal tunnel, rotator cuff problems. It's baked into the job description, almost.
And didn't you mention a study about large herd parlors?
Yeah, over 76% of workers in those settings reported work-related musculoskeletal symptoms.
76%. That's not just a few people. That's the vast majority dealing with chronic pain just from doing their job.
It is. And that constant, sometimes really debilitating pain, well, it creates a very real reason to look for relief.
Yeah.
It often starts instantly enough, right? A legitimate prescription after an injury, just trying to get back to work.
Because you have to get back to work.
You have to. There's this quote in a report from an Ontario dairy producer. It's really powerful. They said, animals don't wait for you to feel better. The cows need milking every 12 hours, just like clockwork, whether it's Christmas morning or you're running 102-degree fever. The work must get done regardless of how much pain you're in.
Oof, that quote just, it hits you right in the gut, doesn't it? We spend so much time and money, and rightly so, on cow comfort.
Better stalls, better ventilation.
The works. But have we really put the same focus, the same resources into farmer comfort, into the well-being of the people actually doing the work? We track lameness scores like hawks.
Absolutely. Every little limp.
But do we even really see the farmer who's limping through the barn chores? Is that the industry we want?
That's the tough question the report puts out there.
Yeah.
And when you add in that relentless schedule, there's just no real chance to rest properly, to heal. The cows always need milking, feeding. The repairs are always waiting.
You can't call in sick. Not really.
So farmers feel they have to rely on something, often medication, just to keep going. And that can be the start of a really dangerous path towards dependency.
It's just like the report says. Just as you wouldn't skip a milking because it's inconvenient, you can't skip farm work because of pain. That constant pressure cooker. No off switch. It's a huge factor.
Huge. And the report includes this really useful table, actually. It breaks down the physical demands, the pain percentages for different body parts, which tasks cause the pain.
But also prevention stuff.
Yeah, and importantly, prevention strategies. Things like using mechanical assists more. Proper lifting technique sounds basic, but easy to forget when you're rushing. Adjustable equipment. Simple things that can make a difference.
Okay, so the physical side is massive, but it's not just physical, right? The report talks about the mental health crisis too.
Absolutely. That's the other critical piece. And it's another area where, historically, our industry hasn't always been the best at having open, supportive conversations.
Definitely. I mean, think about the stresses, the constant financial uncertainty hanging over so many farms.
Volatile milk prices, input costs always seeming to go up.
Those razor-thin margins.
Then you add weather worries, disease threats. Look at HPI right now, the stress that's causing.
Equipment breaking down at the worst possible moment. Regulations constantly changing. It's a massive mental load.
It is. And those Canadian stats on farmer mental health, they're really concerning. Studies keep showing higher rates of stress, anxiety, depression, burnout compared to everyone else.
That Ontario survey you mentioned, a third meeting criteria for depression, almost 60% for anxiety. Those are huge numbers.
Alarmingly high. They really demand attention.
And that other Ontario farmer quote about the pressure never stopping.
Yeah. The cows need milking every day, no matter what else is happening. Market crashes, family emergencies, or your health problems. This responsibility never stops, and that constant pressure weighs on you.
Wow.
It's like having a herd of high-producing Holsteins that never go dry. The demands just keep coming without a break. That feeling of always being on, no real break, it takes a massive toll.
That analogy is spot on, and we as an industry need to really acknowledge that toll.
We do, and the long hours, right?
Yeah.
Often 50, 60, easily 80 hours a week sometimes.
Right.
Plus the isolation that can come with farming. It all adds up. It makes people more vulnerable mentally.
And when someone's dealing with both chronic physical pain and that kind of psychological burden.
Yeah. The temptation to use opioids, maybe first prescribed for pain, but then maybe to cope with the emotional stress too, it becomes a very real, very dangerous possibility.
And like the report says, it's not as simple as just saying, oh, go see a doctor.
Exactly. Which brings us to that whole other massive barrier.
Yeah.
Healthcare access in rural areas.
Right. It's a huge problem we don't talk about enough.
It really is. Just the scarcity of providers. Fewer primary care docs, fewer pain specialists, way fewer places offering specialized addiction treatment.
So you've got this weird, dangerous imbalance. Opioids might be relatively easy to get hold of.
But getting actual help, treatment for dependence, that's incredibly difficult in many rural areas.
That stat that only about a third of rural adults think addiction treatment would be easy to access.
Yeah. Stark contrast to how easily some say they can get painkillers. It's like, imagine having a really sick cow, high-value animal. But the nearest good vet is hours away and totally booked up. By the time you finally get care, it might be too late. Critical, or worse.
That's a powerful analogy. And then you layer on the cultural stuff.
Right, those cultural barriers, that strong emphasis in farming communities on self-reliance. The pull yourself up by your bootstraps mentality.
The stoicism, we handle our own problems.
Exactly. Plus, a real worry about privacy. In small towns, everyone knows everyone, right? The fear of judgment, of people finding out you're struggling, it stops a lot of people from seeking help.
That farmer's analogy in the report about not wanting to put leg bands on a mastitis cow because the neighbors might see.
Yeah, it perfectly captures that fear, that desire to keep struggles private. And the report has another table, this one comparing rural versus urban treatment access. It really drives home the disparities.
Like what, longer travel times?
Yep. Longer average distances to clinics, longer wait times for things like medication-assisted treatment, which is crucial. Far fewer providers offering certain therapies per capita.
Insurance issues too.
Often, yeah. Disparities in insurance coverage. And even telehealth, which could help bridge the gap, is often hampered by poor broadband access in rural areas. It's a systemic disadvantage for farmers.
So this crisis, the effects go way beyond just the individual farmer, don't they? The report talks about ripple effects, farm safety, productivity.
Oh, absolutely. The impact there is huge and, frankly, pretty sobering when you think about it.
Well, obviously, operating heavy machinery or working with large animals while impaired, that's just asking for trouble.
It's a recipe for disaster. And modern dairy farming, it demands so much precision, doesn't it? Mixing rations correctly, following health protocols exactly.
Every detail matters.
And any kind of substance use just chips away at that necessary precision.
And the research backs this up. Missed work, concentration problems.
Yeah, the report cites research linking opioid use to more missed workdays, higher absenteeism, trouble concentrating, just being unable to complete tasks effectively. All of that hits the farm's bottom line. It's smooth operation.
Things get missed. A cow in heat, feed mixed wrong, treatments delayed.
Exactly. And in dairy, margins are already so tight. Even small mistakes can be incredibly costly very quickly.
The report made that sharp point, too, about misplaced priorities.
Yeah, that was insightful. How we can obsess over, a tiny milk quality penalty,
A few cents per hundredweight.
while maybe ignoring the much bigger financial hit from addiction in the workforce, costs that could literally bankrupt a farm. It really forces you to think about where the focus is.
It really does. And you start adding up the costs. Direct costs like healthcare for addiction, ER visits for overdoses.
And then the indirect costs. Lost productivity is huge. Higher employee turnover, which is especially tough in farming. Finding skilled replacements isn't easy.
No, losing someone who knows your cows, your system, that's a major setback. Training takes time.
And then the dairy-specific losses you mentioned. Compromised animal health means less milk. Mistakes with treatments could mean a dumped tank of milk.
Which is a huge financial hit right there.
It all adds up. It's this cumulative financial burden that makes surviving economically even harder.
And then beyond the farm gate, the community impact.
Devastating. The emotional trauma for families dealing with a loved one's addiction. It's immense. Relationships break down.
Financial hardship spreads through the family. Legal problems can crop up.
And thinking bigger picture, it depletes the rural workforce. It erodes the social fabric, strains those support networks that are so important in rural areas.
And maybe one of the scariest long-term impacts, the threat to farm succession.
That's a huge concern. If the next generation, the potential successors, are lost to addiction or incarceration or overdose, what happens to those family farms?
It's a chilling thought, especially when you hear that drug overdoses are a leading cause of death for Americans under 50.
Right. It directly impacts that next generation of farmers. The report uses that stark analogy. It's like losing your best replacement heifers.
Wow, that really drives it home, the future impact.
The long-term, maybe irreversible consequences for the industry's future.
Okay, so we understand the scale, the impact, the vulnerabilities. The report then asks the really hard question, why hasn't the industry tackled this more effectively?
Yeah, why the slow response? And the report points to a few key things. First, that powerful stigma we talked about, especially in ag communities.
So strong.
That culture of self-reliance, being tough, it makes admitting you need help incredibly hard. And the lack of open discussion in industry media, at conferences, it just reinforces the silence, makes it harder to break through.
And those misplaced priorities again.
Exactly. The intense focus on production, genetics, markets, all vital, yes, but often overshadowing the health and well-being of the people doing the work.
That quote asking when cows became more important than the people caring for them.
It's provocative, but it makes you think, doesn't it? We track somatic cell counts meticulously, but ignore the health of the people managing the herd. It's a necessary question for the industry to ask itself.
And the lack of joined-up solutions.
That's another big one. Mental health services, pain management, addiction treatment. They often operate in their own little silos. They don't always connect the dots.
Like treating mastitis, but ignoring the stall conditions causing it.
Exactly like that. You need an integrated approach.
And automation, robots, they help with the physical strain, sure.
But the cost. As the report notes, things like robotic milkers are just not feasible for many farms. So while technology might help some, it doesn't solve the immediate human crisis for everyone. We need solutions that work now for people.
Okay, so it's not all doom and gloom. The report does offer solutions, right? Practical stuff.
Yes, absolutely. And importantly, solutions that are tailored to farming realities. That's key.
Like farm-specific prevention programs, the Promise Initiative was mentioned.
Yeah, programs designed for agriculture, understand the unique stressors, that holds real promise. And organizations like AgWO, Agriculture Wellness Ontario, what they're doing is so important.
The helpline, peer support.
Exactly. That helpline, 1-866-267-6255, is a crucial confidential resource. Peer support, workshops, getting resources out there that farmers can actually use and trust.
And acknowledging legitimate pain, but promoting safer ways to manage it.
That's critical. We can't ignore that people are in real pain, but we need to push safer options. Educational materials using farm language, farm images, distributed through trusted channels like Extension, vets, co-ops. That can really help raise awareness.
And alternatives to opioids for pain.
Definitely. The report stresses making non-opioid options accessible. Physical therapy, ergonomic improvements, strategies to reduce repetitive strain before it becomes chronic pain.
That farmer's quote again about learning proper lifting and getting better equipment making a huge difference.
Yeah, it's like switching from a tie stall barn to a free stall with sand bedding. The cows are more comfortable, and so am I. It shows that investing in farmer comfort pays off. It's not just nice to have.
It reduces reliance on pain meds.
Exactly. And the report asks, why aren't equipment manufacturers marketing comfort and safety more? Why aren't we applying ergonomic principles to parlors like we do to offices? Valid questions.
And improving treatment access. What about that?
Innovative models are needed. Things like RAM clinics, rapid access addiction medicine, mobile services, AMRAM, that bring care to rural areas. And telehealth is huge, obviously.
I mean, if the broadband is there.
If the broadband is there, yes.
Yeah.
That's a big if sometimes. But also, treatment programs need to be flexible. They have to understand farm schedules.
Like vets working around milking times.
Precisely. Offer flexible appointments. And address the cost barriers, sliding scales, better insurance coverage, grant funding. Make it financially possible for farmers to get help.
And peer support, connecting farmers with others in recovery.
Incredibly powerful, especially in farming, where there's that shared understanding. Connecting someone struggling with someone who's been there, who gets it, who's found recovery, that can make all the difference.
Sharing those stories more widely.
Yes. Through ag media, at events, normalize seeking help, challenge the stigma, frame addiction like any other health condition we manage on the farm. Like mastitis, it's treatable, not a moral failing. That shift in perspective is crucial.
So, wrapping this up, what's the big picture responsibility for the industry here?
It's about integration, making farmer health a core priority right alongside production and markets. It needs to be embedded in what industry organizations do.
Dedicating resources, conference time, space, and publications to health topics, including substance use.
Exactly. Sending a clear message about what's valued. That question the report asks, when was the last time your milk check included a wellness bonus? When did your co-op offer addiction resources alongside milk quality incentives? It really challenges the status quo.
And creating recovery-ready workplaces. What does that mean?
It means having clear, supportive policies, balancing safety needs with pathways for employees to get help and support recovery. It benefits everyone, better workforce stability, productivity. Think of it like having a good transition cow program, supporting individuals through a critical time benefits the whole operation.
And advocating for bigger policy changes.
Yes, pushing for better insurance coverage for farmers' mental health, addiction treatment, more government funding for rural mental health, addiction services, and definitely for rural broadband to make telehealth viable.
Okay, so the report ends with some practical steps, right? A farm action plan. Things people can do today.
Yes, really concrete things. First, secure your medications. Simple, but vital.
Locking cabinets for human and vet meds.
Yep. Keep an inventory log, especially for controlled substances, and get rid of unused meds. Properly use those take-back programs. Don't just leave them sitting around. Reduces the risk of misuse or diversion right away.
Makes sense. Second,
implement ergonomic improvements. Invest in that adjustable equipment. Use mechanical assist for heavy lifting. Rotate workers through different demanding tasks to reduce strain. Small changes can add up.
Okay. And third,
create a farm substance use policy. Clear guidelines on medication use, especially around equipment or animals. Confidential ways for people to ask for help without fear. Maybe partner with local healthcare providers for education or screening.
So clear, practical steps.
Exactly. And the report really loops back to the beginning, emphasizing the resilience of dairy communities.
Which is incredible.
But also stressing that this opioid crisis truly threatens that resilience.
Yeah. And that the future of the industry, our sustainability, it depends just as much on the health of our people as it does on our production numbers.
It really does. It's time, as the report says, to break the silence. To confront this crisis with the same determination we tackle other big challenges.
Like we wouldn't ignore a disease spreading through the herd.
Precisely. We can't ignore this epidemic in our communities either.
So the challenge for everyone listening, what will you do today in your operation, your community? Will you check in on someone you're worried about? Secure those meds? Ask your co-op for resources.
Or will we wait? Wait until it hits closer to home, claims another farm, another life. The future really does depend on these choices.
And that final message is so important.
Absolutely. Seeking help is strength, not weakness. Your farm needs you healthy. Your family needs you healthy. Our industry needs you healthy. Just like the herd needs a healthy manager.
So just to quickly boil it down again, 74% impacted, 26% personal misuse. Chronic pain and mental stress are huge drivers. Rural healthcare gaps make it worse, easier to get pills than help sometimes. It hits farm safety, productivity, the bottom line. And we need tailored solutions, ergonomics, telehealth, mental health support designed for farmers.
And that final thought from the summary really nails it. The industry has to prioritize farmer well-being right alongside productivity. It's not an either. It's essential for a sustainable future for dairy.
If this episode resonated with you, share it with one dairy farmer who needs to hear it. Subscribe to the Bullvine Podcast wherever you get your shows and leave us a review. Your feedback directly shapes our coverage of these critical issues. For the full investigation with prevention checklists and ergonomic equipment recommendations, visit thebullvine.com. Next week, we confront the 83.5% failure rate of third-generation dairy operations and reveal the 5 non-negotiable succession strategies that beat the odds. Until then, monitor your meds, check on your neighbors, and remember, healthy farmers build healthy herds.